Then I'll call upon Dr. Madhav AMBEKAR. He will be speaking on how to break the bad news. See, always, not every time is a hunky-dory situation. There'll be sometimes we need to tell the hard facts that the patient can actually have the tinge of displeasure, or it may be really a bad life-changing situation. So in such situation, what are your communication skills that you need to employ, and what the soft skill and the empathy that needs to kick in so that you really do the treatment without, really the patient getting the harsh truth very blunt at him. So over to you, Dr. AMBEKAR.
Thank you, Dr. KP. We have been doing it for quite some time. And actually, this is something like bailing the cat. That any bad news is you have to bail the cat. Because I have slightly enhanced the subject saying that effective communication is a part of breaking the bad news also. So why the communication is important? That you need to understand that what is the patient's demand. He's illiterate in sense of the medical science. He may be a very educated person, but he's illiterate. And in the current context, they try to get the information from the Google, but that's an information, that's not a knowledge. So you have to give then chronicity of the nature is there, like ARMDs or glaucoma or any other disease which are chronic. And you have to have the patient satisfaction and the trust to enhance through the good communication, because that is enhancing the trust becomes the most important parameter where the patient has to understand why the patient has to trust you. So you have to be active listener. You cannot divert yourself from on a phone call or your colleagues or the staff or anywhere that you keep talking to them. So instead of that, you say that I am listening to you, and that is the most important parameter to have better success. And success in terms of good work, good repute, and you have to be a soft-spoken person. To project that you have empathize his disease. You are trying to treat his disease with empathy. And as it goes, that in every culture has got its own system. So calling them we are from Maharashtra, so we speak as kaka and uncle and so on. So senior lady, we call it as dadi or something of that kind. So proper communication is equally important. Most of the time what happens is that breaking the bad news becomes the most difficult task, that we have to bail the cat, because we have to manage the patient's expectation and their anxiety about the things which have happened, and balancing the empathy towards the patient as well as having the professional objective that without threatening the patient, but giving the proper the idea of what the disease and the outcome of the disease itself. So this is the Kalamazoo, which is in the Michigan state. So they have I have given this, that how it should go, that you should be in a calm room and then gather proper information. You should not keep collecting the information while talking to the patient, and try to solve the problem of that complication so that patient's relatives are happy. So during the first visit, you have to get proper connected with the patient. You have to have the perfect listening what patient is talking and what he wants to say about his disease. And always do not think in terms of chair time, that he has been sitting for more than 2 minutes, 3 minutes, and so on. So it is always better that you should have a proper listening. An ear has to be there, and counseling becomes the main crux of the story. So get yourself to reach to the root cause of the complaint. You are a primary eye surgeon. Patient would come to say that vision has become poor. But you cannot say that I am just a glaucoma surgeon, I am not a retina surgeon. You try to reach to the cause of the disease, and then even if you are not able to treat it, but properly you have to send the patient at a place appropriately where the patient has to go. That keeps sending patients to Kurish also for some low vision aids situations. And because of which, once you have understood the disease, the patient will get a confidence. So even if the patient is sent at a local level also here in at my place, I have never lost a single case in last so many years of time. We have to read the body language, what patient has to communicate. During the follow-up also, we try to remember the patient, have a recognition smile and so on. So this is not the part of the breaking the bad news variety. Now it comes as a technical and the commercial counseling also, because patient doesn't understand the technical intricacies of what you are trying to communicate. So you have to give the appropriate and reasonable examples from his line. And then as correctly Kurish has said, my common example is if a lady is there, we say that somebody is asking you to make something, and it is always there that you prepare, but then the fellow will say that there are 5 people for dinner or lunch. He will never say that use this much of the salt and this much of the other details into the whatever vegetable you are making it. So effectively, without putting the technical intricacies of the medical terms, you try to explain them in their own language. Give them the bird's eye view and make them aware about the procedure and what are the chances. Because I keep coming across patients, those who have been given the anti-VGFs for n number, literally the n number of times. Patient has paid more than 3 and 4 lakh rupees, and patient has never been counseled that what are the possibilities of vision to remain constant or the improvement. So we need to have, as I said, we don't threaten the patient. As I gave you the example that ARMD patients are most unhappy, so whatever number of injections you are trying to give them, that you have to give a proper idea. It's like an orthopedic surgeon, you know. Orthopedic fellow will keep saying कि इसको अभी ये plaster 4 हफ्ते रखते हैं. 4 weeks down the line he would say नहीं थोड़ा सा भी बाकी है, then we'll keep it for 2 more weeks and so on. So we have to be giving him a proper idea that what is the end result and what will be the end point, both. Unrealistic outcome is very important, that as Kuresh has correctly said that chashma hi nahi lagega wali baat hi nahi. The spectacle dependence will become less. You will not have a spectacle free vision. And patient always has that more amount is paid, that there are huge expectations. And I always say that I am in the healing ministry. Charges is the billing ministry. So I don't look after the charges. So somebody else would go into the billing ministry, that you talk to the billing ministry, while I'll give you the idea about the healing ministry only. So counselor will give an idea. Now, what is the bad news? Any information that is negatively implying, let it be anything, like a nucleus drop, not putting the IOL, or advanced glaucoma, anti-VEGF related, the ARMDs and so on. So effective, you have to give what are all these bad news are there, and effectively requires the empathy, clarity of vision, and making the patient prepared to accept that bad news. Like it can be a choroidal melanoma also, which is very uncommon in our area, but I have seen almost 3-4 cases in my entire career. So medical errors and surgical complications is also a major bad news, which KP is going to tell about. So this is the protocol, that setting up a proper place, then giving a prescription, ask the patient what he would like to know about, give him a knowledge with an emotional respect about the patient, and summarize everything so that you can close down on the case. Giving the baseline idea of any table issue, that again KP would tell us, but then you have to give the realistic what has happened without giving the lot of medical clutter to him, and for which your own calmness is the most important parameter which is there, and maintain absolutely subtle voice so that patient will never feel that you are under anxiety and stress. Immediately, it is always better to tell the patient that lens has been put in, or that some different variety of the lens has been put in immediately post-op. So without giving into the medical, too much of the medical terminologies, and give accurate information which is masked but actual information, and about their concerns that if posterior pelvic cataract, the nucleus has dropped, tell them that this has happened, and then you have to go to the VR surgeon, which anyway we have counseled at the beginning itself only. And you have to be assertive but meaningful. As it goes that net gurus are always there, that Google doctors are there. So you have to make them understand that what you get on the net is the information. It is not your knowledge. You have to apply wisdom to put that information into knowledge. Because I give a most common example is that looking into the YouTube, somebody in the US started making some Indian dish, and then he called after, "Mummy, wo आधा घंटा हो गया, dish तैयार नहीं हुआ है." Then suddenly mom realizes that on the video that he has not put on the gas, because YouTube has not asked them to put the gas on. So the gas was not on. So it was like a Virbal's khichdi, that he was putting the utensil on the gas without putting on the gas. So it is something of that kind, that information and knowledge are different. And any such things, you have to keep your anger under control, because you are into the service industry, and have a proper communication. So unless you get into the proper communication, the bad news has to be properly put to the patient. That is most important. Thanks, KP. Anything, normally if anybody has a problem, they can ask me also that how you present certain bad news also, as he has asked about the posterior polar cataract.
The bad news is you only have 10 minutes, sir. This we could have gone on and on. Thank you so much, Dr. Madhav.